As Mr. Tim Kelsey joins us, ladies and gentlemen, as I mentioned, he is the CEO of the Australian Digital Health Agency. I would like to request Mr. Kamal Narayan to kindly present a bouquet extending our greetings. And would also like to let you know, ladies and gentlemen, that he's also the chair of GDHP, that's the Global Digital Health Partnership. And this is a partnership of 25 countries now, because Chile has joined. So we had this summit. India, in fact, was a host to the GDHP summit, the fourth summit which was organized, and the first in India. Australia started the summit, and then US and UK, and now India. And this brings together 25 countries of the world along with WHO towards a common cause or a common work of digital health. And that is where Mr. Tim Kelsey is the chair of it, of GDHP. Further, as the CEO of the Australian National Health Agency, they have been working towards ensuring good health to the citizens of Australia through safe, secure technologies, global digital technologies imbibing that. And that is what India is also aiming, as we saw in the platform also, as Dr. Indubhushan had introduced, an IT-connected platform, a seamless platform as it is going to be working. And then India is also working on the National Health Stack, that is the health information system which India is working on. So a lot insights and guidance we'll seek from Mr. Tim Kelsey. So thank you for having joined us. And as I understand, Mr. Indubhushan has to leave, but thank you, sir. It actually sets the tone in the context of our discussion. We know what now the scope is, what the mission is, what the vision is of this program, and what each one of them as stakeholders and responsible stakeholders of the healthcare sector need to work towards. Thank you once again very much, sir. We would like to present a small token of our gratitude, appreciation, request you to kindly accept this. Thank you very much, sir. May I also request Ms. Nikki Gupta, the co-founder, to please join as we express our thanks. Okay. Can we all together? So that's the memento as we recognize him as the torchbearer of Ayushman Bharat. Thanking once again Dr. Indubhushan. And now I would like to request Mr. Tim Kelsey to address this August gathering and more introduce us of, again, how each of them can be partners towards Ayushman Bharat shaping that. Your comments, your remarks.
Thank you very much, and great privilege to address this august assembly, so thank you. Just having heard the remarks, I'd like to start by saying that I think that the principle of universal healthcare is the most important social policy legacy of our generation. There is nothing more important than equity of access to health services regardless of the ability to pay. And it is an extraordinary achievement that India has developed an approach to the coverage of the sort that is described here. My personal belief and view is that the key precondition for successful implementation of universal healthcare is technology. Of course, digital health, whatever words you use, is essentially about human beings. It is not a technology principle. It is, of course, a clinical and an economic imperative, but above all, it is a human imperative. It is an imperative about improving equity of access to health services, about empowering the patient, the citizen, those who serve them, the professionals. It is about accountability and transparency. It is about the evidence that universal healthcare improves people's health and well-being. And I'm just going to spend a few moments describing how I think digital health technology can support those three core values. We should start by reflecting on the enemy in front of us, which is paper. In the background of modern healthcare in India, in Australia, in the United Kingdom, we hear the scratch of pen on paper. We hear the engine igniting as it leaves the warehouse. The lorry leaves the warehouse with the paper records to take them to the hospital. We hear almost endemically in modern healthcare the hum and whir of the fax machine. We know that these things are dangerous. In Australia today, around 250,000 admissions occur each year because of medication misadventure. There are more people that die from medication error than from road traffic accidents. And this is largely because the prescribing physician does not have access to the most recent history of a person's medicines and makes a mistake. And this kind of mistake is intolerable in modern society. It is something that is a scourge and a blemish on our civilized values. So last February, we founded the Global Digital Health Partnership, at that point a collaboration of 9 countries. And we did this because we are frustrated with the way in which we have been slow to deliver the benefits of technology in healthcare in a way that we have experienced in so many other parts of our life. We have lagged behind the airlines industry, the finance industry, and so on. And these 9 countries under the World Health Organization came together to celebrate the opportunity for international collaboration in driving the cause of universal healthcare through improved application of technology. And it was no accident that in that first meeting we were addressed by your Union Minister for Health and Family Welfare, the Honourable J.P. Nadder, who observed then that technology was the key precondition for modern healthcare. And indeed, in our 4th summit, so since Canberra, we've had meetings in London and in Washington, and this week we were greatly privileged to be hosted by Minister Nadder in New Delhi. And what he told us then was that technology remains a key priority for the Indian government. We were addressed by the Director General of the World Health Organization, Dr. Tedros, who told us that in his view, the future of health is digital, is his quote. Now let's just unpack what that means. What that means is that if we can connect health services on the front line of care delivery so that they can share information safely and securely, that lives will be saved, that people will be referred more quickly for treatment, that the quality of that treatment will be administered faster, that the right medicines will be prescribed more often than they are today, that if we apply, for example, telemedicine to episodes of care that are empowered by such services, we will dramatically improve equity of access to health services. A sobering fact, in Australia, a land actually roughly geographically equivalent, I think, to the size of India, but of course with far fewer people, the importance of remote rural access to healthcare is a key priority for the Australian government. And perhaps surprisingly, despite the very low cost of video conferencing and similar tools, only 1% of episodes of care amenable to telehealth are currently transacted digitally. And people are traveling days sometimes on buses to go and see the consultant in the outpatient, for the outpatient appointment, when, to be honest, technology has solved that problem. So we need to work much harder, I think, on the clinical culture of our health services to improve the adoption of digital technology in practice. But the first value of doing so is to improve the quality safety, and equity of access to healthcare. The second value of universal healthcare and the power of technology to transform it is empowerment. So we, as patients, are passive. We take often the advice of our doctor or our clinician without question. We do not act as we do when we are consumers of other services. And universal healthcare implies opportunity for better health, but also responsibility for us to live healthier lives and reduce our burden on the universal health care system that we fund. It's vital for successful universal health care that we're able as people to discharge that responsibility, to live healthier lives, to take more control of our well-being, and technology supports us to do that. We learnt this week, for example, of the NHS app, a service in England just recently launched, which allows people to book appointments with their GPs, to search credible information about their conditions, and so on. Uruguay has just launched a consumer portal which allows people to choose which health provider they want to go to and compare the quality of outcomes reported by those providers. Empowerment may be the most important single priority for us as we promote universal healthcare, because in the future, the more active patient, the more active consumer will drive the design of universal healthcare systems, and we need to work really with focus on improving the literacy of our population in both digital tools and, of course, more broadly in health itself. So alongside our desire to support people to take advantage of their mobile phone, to access health services, to learn more about how they can improve their health and well-being, we have to also support their literacy, their ability to engage with that information. It's a really vital priority for us in these early days of such an important principle as universal healthcare. And then the third value I just wanted to draw your attention to is the value of accountability and transparency. What I mean by this is not performance management. I mean the positive support and development of our clinical workforce. People, doctors, nurses, physiotherapists want to know how they can do a better job to support us in our health and well-being. And they want the data with which to do that. They want to know how they compare to their peers in improving the quality of their outcomes. And we need to provide that data to them. Digital technology supporting the consumer over here to take better decisions, improving the quality of healthcare over here, and access also produces the data with which individual professionals can improve their practice by comparison to their peers across their profession. And this transparency has never been possible before in any meaningful way. This is about the dramatic opportunity to improve the quality of healthcare science, its professions, that's never existed previously. And we must embrace it. We must regard universal healthcare with its comprehensive coverage as a tool for supporting our clinical workforce, those care professionals, to improve the quality of their outcomes. I think we will be judged as a generation on our delivery of universal healthcare. And we have no option but to succeed. Paper-based healthcare not only is dangerous, it will fail us. It will not provide the comprehensive vision that we've just heard of supporting the poorest in society to have access to important, vital health services. But beyond that, it will also fail us to provide access to the new medical sciences, genomics, microbiomics, omics in general, the new diagnostic tools that will support us through our lives, manage our risk of ill health and well-being. Paper-based healthcare cannot support precision medicine, and a world full of fax machines will not be full of genomically described risk stratification. And this obligation on us today is not just about our own health, it is about our children's health and the health of their children. Thank you very much.